She pressed both hands onto the man's chest and started pumping, hard, fast, rhythmic, while the resident stood frozen, mouth open, not a single word coming out. The crash cart was already in her hands before the alarm finished sounding. Nobody called her name. Nobody gave her an order. She just moved. And in that moment, the head surgeon, a man who had seen 30 years of trauma, went completely white. 3 hours. That was all it took. 3 hours for Laura Keating to change everything they thought they knew about her. If this story hits you, subscribe to this channel, follow along until the very end, and drop a comment telling me what city you were watching from. I want to see how far this story travels. The morning Laura Keating walked through the front doors of St. Alders Hospital, nobody looked up. That was fine with her. She was 32 years old, Irish-American with long brown hair. She kept tied back in a tight, precise knot. Not because the regulations required it, but because loose hair in a trauma bay could get someone killed. She moved quietly across the linoleum floor, her rubber-soled shoes making almost no sound, and she found her locker, opened it, and began hanging up her jacket with the kind of methodical calm that made her look like she'd done this 1,000 times before. Because she had, just not here. A nurse named Donna, charge nurse, silver-streaked hair, voice that could cut glass, stopped at the end of the hallway and looked Laura up and down the way a general inspects a new recruit. Her expression didn't offer a lot of warmth. "You're the new hire," Donna said. "Laura Keating." She extended her hand. "First day." Donna shook it once firm, then let go. "Whitmore doesn't like chatty nurses. Keep your head down, follow protocol, don't overstep." She paused. "You understand what that means in an ER? It means I do my job and nothing more." Donna gave a thin smile. "Good. Station 3, intake forms are in the blue binder." Laura nodded. She picked up the blue binder. She did not complain. She did not ask questions. She simply began reading it from the beginning, every protocol, every procedure, every emergency code, while the morning shift buzzed around her like she was a piece of furniture. She had been on the floor for 40 minutes when she noticed the man in bed 7. He was middle-aged, heavy-set, brought in for what the intake form listed as lower back strain. He was sitting up watching TV, laughing at something on the screen. By every visible metric, he was absolutely fine. But Laura had stopped moving. She stood near the nurse's station, binder in hand, and she looked at him, not at his chart, not at his monitors, at him. His left forearm, the way his skin had taken on a very faint mottled coloring near the elbow. The way he shifted in the bed every 30 seconds, just slightly, like something was pressing on him from the inside. She walked to the attending physician station. The doctor on call, a Dr. Reeves, was typing notes and didn't look up. "Dr. Reeves," Laura said, "bed 7. I think there may be internal bruising inconsistent with a simple lumbar strain. His skin tone on the left arm." Reeves looked up. He blinked at her badge, then at her face with the expression of someone interrupted by background noise. "He came in for back pain," he said. The paramedics assessed him en route. "I understand, but the bruising pattern... Are you a doctor, Ms.?" He glanced at her badge again. "Keating." "No." "Then let's leave the diagnostics to the medical team." He turned back to his screen. Laura stood still for exactly 3 seconds. Then she walked back to her station, picked up the blue binder, and wrote a single line in the small personal notebook she kept in her left pocket. "Bed 7, possible internal, report logged 8:47 a.m. 2.5 hours later, the man in bed 7 was rushed into surgery. Delayed internal hemorrhage. The trauma team called it a near miss." Nobody mentioned Laura's report. Nobody connected the dots. But the man's wife, a small woman in a yellow cardigan, stopped at the nurse's station on her way out and set down a white cardboard box tied with a ribbon. "Whoever noticed," she said, "please make sure she gets these." Inside were a dozen chocolate chip cookies and a folded note that read, "Thank you for noticing her husband when nobody else did." Donna read the note, then looked across the floor to where Laura was quietly updating records. She said nothing. The days that followed had a pattern. Laura would arrive early. She would check the supply cabinet, not because she was told to, but because, in her experience, the things you assume are stocked are exactly the things you run out of at the worst possible moment. She would review the patient board with the same careful attention she'd once given to mission briefings. And then she would move through her shift like water quiet, steady, finding the cracks that everyone else rushed past. A young doctor named Chen caught her one morning opening every cabinet in the supply room one by one, checking contents against a mental list. He crossed his arms and leaned against the doorframe. "You know we can just call for more supplies, right?" he said. "This is an ER, not a survivalist bunker." Laura looked at him. "Have you ever had a patient go into anaphylactic shock at 3 a.m. and discovered the epinephrine was 3 units short?" Chen opened his mouth, closed it. "I have," she said simply. She closed the last cabinet and walked past him. He stared after her for a long moment, something flickering across his face that he couldn't quite name. 2 weeks in, the staff had formed their opinions. Too slow. That was the consensus. Too careful. Too methodical. The ER ran on speed on gut instinct and fast hands and the ability to make decisions in 3 seconds or less. Laura Keating did everything carefully, and in emergency medicine, careful looked a lot like hesitation if you didn't know the difference. Donna pulled her aside after a Wednesday shift. "I'm going to be honest with you," Donna said. She had the decency to lower her voice at least. "You're not cut out for frontline care. The pace here, it's not for everyone. There are positions in the back office, records management, patient discharge coordination. They're important roles, no shame in it." Laura looked at her steadily. "I appreciate the concern. It's not concern, it's a practical assessment." "Noted." Laura picked up her jacket from her locker. "I'll see you tomorrow." Donna watched her go with the look of someone who just tried to move a wall with her shoulder. The thing nobody understood about Laura Keating was this: she wasn't slow. She was precise. There's a difference. Slow means you haven't decided what to do yet. Precise means you already know exactly what you're going to do, and you're doing it in the right order. While other nurses rushed, Laura observed. While others reacted, Laura had already predicted. And while the rest of the staff chased the obvious emergencies, the screaming, the bleeding, the loudest crises, Laura was quietly diffusing the ones that hadn't announced themselves yet. The elderly woman in bed 12 whose heart medication had been dosed wrong by a full increment. Laura caught it during a routine check and quietly corrected the chart before anyone had to make a mistake. The 17-year-old who came in after a soccer collision laughing it off, saying he was fine. Laura sat with him for 3 minutes, asked him 2 questions, and then pulled the attending aside and said his left pupil is responding differently than his right, and he's been repeating the same sentence without realizing it. The concussion scan confirmed a grade 3 injury. Another hour and they might have sent him home. The construction worker with the infected forearm who'd been waiting for 4 hours. Laura cleaned the wound properly, thoroughly, the way it hadn't been cleaned in the fast initial treatment. The infection didn't become sepsis. He never knew how close it had come. She kept every one of these moments in her notebook, not for credit, not to prove anything to anyone, just to remember, just to learn. Just to get better at reading the language the body speaks when it's in trouble and doesn't know how to ask for help out loud. It was a Thursday afternoon when Dr. Alan Whitmore first really noticed her. Whitmore was head of surgery, 58 years old, built like a man who had once been an athlete and still carried himself like one. He had a reputation that preceded him through every hallway of St. Alder's, brilliant, exacting, and possessed of zero tolerance for anything that wasted his time. He was standing at the edge of the trauma bay when a paramedic wheeled in a car accident victim, a man in his early 30s, conscious, talking with a laceration on his forehead that was bleeding impressively, but not dangerously. The team converged on the obvious, the head wound, the visible injuries. Laura was standing at the edge of the bay. She wasn't assigned to this case. She had no business being there except that she'd been passing through when the gurney rolled in. She looked at the patient. She went still. Then she walked to the attending physician, not Whitmore, a resident named Park, and said quietly, "His skin has a slight ashen tone, not from shock. His breathing is shallow on the right side. I think we should get a CT before we—" "He's alert and responsive," Park said without looking up from the head wound. "GCS is 15. We're treating the primary injury." "I understand, but the Ms. Keating." Park finally looked at her. He was young, tired, and not in the mood. "You're not assigned to this case. Please return to your station." Laura stood for a single moment, then she stepped back. Whitmore had been watching from 6 feet away. He didn't say anything. 2 hours and 17 minutes later, the patient crashed. Splenic laceration, internal hemorrhage, the kind that builds slowly and quietly and then announces itself all at once like a dam giving way. He went into surgery immediately. He survived. In the debrief afterwards, someone mentioned that a nurse had flagged the case early. Park didn't respond. The team moved on. Whitmore, standing at the back of the room, wrote a single name on the notepad he always carried, Keating. That evening, Laura sat alone in the hospital cafeteria. She had a sandwich she wasn't really tasting and a medical journal open on her phone to an article about soft tissue injury patterns in high-velocity trauma. The cafeteria was half empty, the dinner rush had thinned out, and the few people who remained were talking in low voices or staring at their own phones. From her scrub pocket, she took out a silver pen. It was plain-looking, simple brushed metal, but if you look closely, you could see the initials engraved near the clip. Deep, in standard medical notation, DP meant differential pressure. The subtle, invisible difference between stable and catastrophic. The thing most people couldn't detect because it didn't wave its arms. It didn't shout. She turned the pen over in her fingers once, twice the way some people handle worry beads or rosary beads, and then she put it back in her pocket. She picked up her sandwich. She kept reading. A young nurse she vaguely recognized, Jessica, she thought second year, dropped her tray across the table and sat down uninvited. "You flagged the car crash guy this afternoon, didn't you?" Jessica said. Laura didn't look up from her phone. How did you know? The color of his skin didn't match the severity of the head wound, and his breathing was asymmetric. Jessica frowned. His O2 sats were normal. Sats can lag. The body compensates until it can't. Silence. Jessica poked at her food. "They're saying you overstepped," she said finally. "Some of the residents. They're welcome to that opinion. Does that not bother you?" Laura looked up from the phone for the first time. She looked at Jessica with those calm, steady eyes, the eyes of someone who has learned to measure their words the way a surgeon measures a cut. "What bothers me," she said, "is when someone doesn't come home who should have." Jessica didn't know what to say to that. Laura went back to her journal. She kept in the other pocket of her scrubs, the one opposite the pen, a thin silver bracelet. She never wore it. She just carried it. The inside of the bracelet was engraved with numbers and letters that looked at first glance like a serial code. But they were coordinates, 36.3398 degrees north, 43.1189 degrees east. Mosul, Iraq. She never talked about it. Not to Donna, not to Chen, not to any of the residents who had formed their quiet, dismissive opinions about the new nurse who moved too carefully and didn't fit the pace of the emergency room. Nobody knew about Mosul. Nobody knew about the 14 months she'd spent there, or the kind of medicine she'd practiced, or the weight of the decisions she'd made in places where the crash cart was sometimes a field kit and the operating theater was sometimes the floor of a building that no longer had a roof. They just knew she was slow, careful, quiet, too quiet maybe for a room that ran on noise, and that was exactly how Laura Keating needed it to stay. For now, the radio crackled. It was a Tuesday evening, 6:43 p.m., 43 minutes before the shift change and the ER was running at its standard controlled chaos when the dispatch call came through. Every staff member in the room heard it at the same time. "St. Alders, this is Unit 7. We have a multi-vehicle collision Highway 45. Bus and semi-truck, 14 casualties confirmed, multiple criticals, ETA 7 minutes. Repeat, 14 incoming 7 minutes. The room changed. It changed the way a sky changes before a tornado. Not all at once, but in an instant, everything shifted. Dr. Alan Whitmore was through the trauma bay doors before the radio finished crackling. He moved to the center of the room and his voice cut through the noise, the way a blade cuts through water, sharp, clean, no wasted motion. "All hands, trauma bays 1 through 6 activate now. Senior nurses take the critical patients as they come in. Residents, you're on walking wounded and secondary triage." He turned. His eyes swept the room with the precision of someone who had done this many times before and knew exactly what he needed from every person present. "Chen Bay 1, Park Bay 3, Alvarez, you're with me." And then his eyes landed on Laura. She was standing at her station gloves already half on, watching him with that expression she always wore, calm, attentive, completely unreadable. "Keating," his voice didn't change tone. "Station 4, paperwork and basic intake. Do not make any medical decisions without direct supervision." "Understood." Laura looked at him. "Understood," she said. She pulled her second glove on. He moved on. She turned to face the doors. Outside, the first ambulance was already pulling in. The woman on the first gurney was 47 years old, conscious and terrified. Her name, the paramedic called out, was Renee Torres, passenger. Driver's side impact, obvious right arm fracture, possible rib involvement, GCS 14. She was assigned to Bay 4. Laura's Bay. A resident's second-year name tag reading Dr. Marcus Webb moved to Renee's side and began the standard trauma assessment. He was efficient. He was following protocol exactly. Laura stood at the foot of the gurney with a clipboard and began filling out the intake form. She was filling out the intake form, and she was also watching Renee Torres breathe. The breaths were short. Not from pain, the rhythm was wrong for pain. Too shallow, too fast, but not the fast of someone hyperventilating from fear. This was the fast of someone whose body was working twice as hard to pull in air and not getting twice the result. Laura's eyes moved to Renee's skin. The color was a few shades too light for a woman who was otherwise clearly Mediterranean complexioned. Not pallor from shock, something else. Something quieter. She looked at the blood pressure reading on the monitor. 98/64. It had been 102/68 3 minutes ago, according to the paramedic's handoff. It was dropping, slowly, but it was dropping. Laura set down the clipboard. Dr. Webb, she said. He was checking the arm fracture. Not now. Her MAP is declining, 4 points in 3 minutes. She's stable. He didn't look up. Clipboard keying. Laura picked up the clipboard. She also, without being asked, without being authorized, without making a sound about it, reached over and started an IV line in Renee's left arm. She began a slow, controlled, fluid resuscitation. Webb looked up. His expression went sharp. I didn't authorize. Her mean arterial pressure is 72 and falling, Laura said. Her voice was completely level. If we wait for it to trigger an alarm, we'll be 2 minutes behind. You are not cleared to... And then the alarm went off. Not a slow warning. A full code. Renee Torres went into cardiac arrest. Laura was already moving. Her hands found the crash cart before Webb had fully processed what was happening. Her fingers located the leads, the paddles, the medication tray, with a fluency that had nothing to do with hospital training and everything to do with something far older, far harder, built into her hands by circumstances she never talked about in cafeterias. She began chest compressions. 30-2. Perfect depth. Perfect rhythm. Charging, she said. Stand back. Webb stepped back, not because he made a decision to, because something in her voice removed the option of not doing it. Epi 1 milligram IV, she said to the room, to no one specific, to whoever was closest. Now. A nurse across the bay grabbed the medication, administered it. Laura kept going. From Bay, 220 feet away, Dr. Alan Whitmore heard the call. He turned from his own patient who was being handled, and he looked across the trauma bay. He saw a nurse he had assigned to paperwork running a resuscitation with the calm mechanical precision of a trauma surgeon. He did not move for a full 4 seconds, because in 30 years he had never seen anyone move quite like that. He had also in 30 years never seen anyone's hands know exactly where everything was before they looked for it. Laura called the rhythm, she called the medications, she called the timing. And 3 minutes and 40 seconds after Renee Torres's heart stopped, it started again. Webb stood at the edge of the bay staring. The monitor beeped. Steady, strong. Laura stepped back. She picked up the clipboard from where she'd set it down. She began finishing the intake form. Nobody in that room said a word. And outside through the double doors, the second ambulance was already pulling in. The second ambulance brought in a teenage boy, 16, maybe 17, still wearing his backpack. The strap had been cut by the paramedics, but the bag itself was still tangled around his left arm, like he'd refused to let go of it, even unconscious. His name, according to the emergency contact card in his wallet, was Danny Cho. His mother was already in the waiting room. They could hear her from inside the trauma bay, not screaming, which was almost worse. Just saying his name over and over in the particular quiet of someone who was too frightened to make noise. Laura was still at Station 4. She had finished Renee Torres's intake form. She had written every detail with the same precise handwriting she used for everything, and she had clipped it to the chart, and she had stepped aside so the team could take over Renee's post-resuscitation care. She had not said anything else. She had not explained herself. She had simply moved back to the position she'd been assigned and picked up the next clipboard. But the room had changed around her. Webb was still standing near Bay 4 with an expression on his face that belonged to someone who had just watched something they couldn't categorize. He kept looking at her and then looking away, like he was trying to solve an equation that didn't match any formula he'd been taught. Across the bay, Whitmore had gone back to his patient, but his attention hadn't. Laura felt it, the shift in the room's weight, the way people's eyes moved differently now when they passed her station. She had felt that particular kind of attention before in other places, and she knew what it meant, and she did not want it. She focused on the clipboard. Danny Cho was brought to Bay 520 feet from her. The resident on his case was a woman named Dr. Priya Anand, third-year sharp, good instincts, the kind of doctor who moved fast and made good decisions under pressure. Laura had watched her work twice before and noted it without comment. Anand was calling out findings as she assessed Danny. Laceration on the right temple, possible clavicle fracture. GCS 13 trending toward 12. He was fading in and out, answering questions in short syllables, losing the thread. Laura was writing intake forms. She was also listening. She heard the GCS drop in Anand's voice before she heard the number. 13 to 12 to Anand called it as 11. The boy was sliding, and then Laura heard something Anand didn't say. Because Anand was focused on the obvious injuries, the laceration, the clavicle, the dropping consciousness, the way any good doctor would be. But nobody had mentioned that Danny Cho was breathing at a rate of 22, and his face, even from 20 feet away, had the particular fixed quality of someone whose brain was working too hard just to keep the lights on. Laura set down her clipboard. She crossed to Bay 5 without being asked. Anand, she kept her voice low. Anand didn't look up. Not your Bay Keating. Pupils. A beat. Anand looked up. What? Check both pupils, now. Something in Laura's voice, not urgency, not alarm, just an absolute certainty, made Anand lift her penlight without deciding to. She checked the left pupil. Normal. She checked the right. She went still. The right pupil was sluggish. Not blown, not yet, but sluggish. Epidural hematoma, Laura said quietly. He needs a CT in the next 10 minutes or we're looking at herniation. Anand stared at her for 1 second. Then she was already moving, already calling for the imaging team, already pushing the gurney toward the door. Danny Cho was in the CT scanner 4 minutes later. The scan confirmed a small but rapidly expanding epidural bleed. He went to surgery within the hour. He survived. He walked out of the hospital 9 days later with a scar above his right ear and a mother who couldn't stop crying every time she looked at him. Anand didn't say anything to Laura when she came back from radiology. She just looked at her with an expression that was somewhere between gratitude and something much more complicated, and then she went back to her next patient. Laura went back to her clipboard. Whitmore had watched the whole exchange from Bay 1. He hadn't moved. He hadn't intervened. He had watched Laura cross to a bay. She wasn't assigned to make a single clinical observation in 11 words and redirect the course of a teenager's entire life. He turned back to his own patient and said nothing. But the notepad in his pocket now had 2 lines under the name Keating. The 3rd ambulance arrived, and the 4th, and then they stopped counting ambulances and started counting minutes. The next 90 minutes were the kind that don't separate into individual memories afterward. They compress. They become a single continuous roar of voices and monitors and the specific smell of blood and antiseptic and adrenaline that anyone who has ever worked in emergency medicine carries with them for the rest of their life. Laura worked Station 4. She filed intake forms. She ran basic vitals. She changed IV bags and repositioned patients and did exactly what she had been assigned to do. And while she did it, she watched everything. A woman in Bay 2 with a pulse ox of 94, not alarming, not technically critical, but dropping 2 points every 10 minutes like a slow leak. Laura flagged it to the charge nurse. The charge nurse ordered an additional respiratory assessment. The bronchospasm was caught before it became something worse. A man in the waiting area, not yet processed, still in the chair where the triage nurse had parked him, whose left hand had gone from red to pale to slightly blue in the 40 minutes since he'd arrived. Laura stopped at the triage desk and said 3 words. Left hand now. The triage nurse looked. The arterial compromise was caught in time to save the hand. She never raised her voice. She never pushed. She made observations, she communicated them clearly, and then she moved on. But the observations kept being right. Every single one. It was the kind of accuracy that didn't feel like luck after the third time. After the third time, it felt like something else, something that the staff of St. Alder's didn't have a clean category for in their mental filing systems. Something that made Webb stop avoiding her eyes and start watching her instead with the focused attention of someone who has realized they've been looking at a painting upside down. It was at the 90-minute mark that the argument happened. There was a man mid-50s construction build name tag from the bus, said Gerald Marsh, who had been triaged as non-critical. Stable vitals, no obvious injuries beyond bruising on his chest and left shoulder. He was in the secondary area waiting for a standard assessment, and he was being loud about the wait. "I've been here over an hour," Gerald was saying to anyone who would listen. "Over an hour. I'm fine. I keep telling them I'm fine. Why won't someone just look at me and let me go home?" The nurse managing the secondary area, a man named Brian who had been on for 12 hours already and was running on coffee and willpower, had checked Gerald's vitals twice, both times normal. He had flagged him as stable and moved on. Laura was passing through on her way to the supply cart when she heard Gerald. She stopped. She looked at him. Gerald Marsh was red in the face from frustration. He was gesturing with his right hand. His left arm, she noticed, was hanging slightly lower than his right, not paralyzed, not obviously injured, just hanging, like it was heavier than he remembered. She walked over. "Mr. Marsh," she said. He looked at her with the expression of a man who has been waiting too long and is preparing to say something he might regret. "Are you finally going to? How long has your left arm felt heavy?" He stopped. His mouth closed. He looked at his arm as if he hadn't consciously registered it until she named it. "I don't know. Maybe an hour. I figured it was the seatbelt." "Does your jaw feel tight? Any pressure in your chest? Even slight?" Gerald frowned. "A little. I thought it was..." "Brian." Laura turned to the secondary nurse. 12 lead EKG on Marsh, now." Brian looked at her badge. "He's been assessed, twice Keating. The vitals are normal," Laura said. "That's what worries me." Something in her delivery, that same absolute quiet certainty, stopped Brian mid-sentence. He looked at Gerald, then at Laura. Then he sighed and reached for the EKG leads. The result came back 3 minutes later. ST elevation. Subtle, easy to miss, but they're a textbook STEMI pattern hiding beneath a presentation that looked at every surface level like a man who'd had a rough morning and was impatient about the wait. Gerald Marsh was having a heart attack. He was in the cardiac unit within 12 minutes. The cardiologist who received him said later that another 45 minutes and the outcome would have been very different. Brian didn't say anything to Laura afterward. He just stood in the hallway for a moment, staring at the door Gerald had been wheeled through, and then he walked back to his station and sat down heavily in his chair. It was then that Donna found her. The charge nurse had been managing the chaos of the mass casualty from the administrative side, coordinating beds, managing the waiting area, dealing with the families. She had been doing her job with the kind of iron efficiency that made her essential in a crisis, even if she wasn't always warm. Now she crossed the floor to where Laura was updating charts at the nurse's station, and she stopped in front of her, and she was quiet for a long moment. Laura kept writing. "Keating. How many times tonight have you crossed into a case you weren't assigned to?" Laura set down her pen. She looked up at Donna. 5 times, she said, "and I would do all 5 again." Donna studied her. Her expression was not what it had been 2 weeks ago when she'd suggested the back office. Something had been recalibrated in it, not warmth exactly, but something adjacent. Something that looked like reassessment. "The Torres resuscitation," Donna said. "That wasn't a nurse running a code. That was..." She stopped. "Where did you train?" Laura held her gaze without flinching. "Different places." "That's not an answer." "No," Laura agreed. "It isn't." She picked up her pen. "Are you pulling me from the floor?" Donna was quiet for a moment, then no. She turned to leave. Then she stopped with her back still to Laura, and she said without turning around, "The Torres family is asking for the nurse who saved her. You don't have to go, but I thought you should know." She walked away. Laura sat with that for a moment. Then she stood up, walked to Bay 4, and pushed through the curtain. Renee Torres was awake. She was pale and tired, and she had an oxygen cannula and 4 monitors attached to her, and her husband was sitting on her left side holding her hand, and when Laura came in, they both looked up. Her husband stood immediately. He was a big man, dark-haired, with the kind of face that was trying very hard to hold itself together and not quite succeeding. "Are you her?" he said. "Are you the one who—" "I'm Laura. I was one of the nurses on her case." He reached out and grabbed her hand with both of his. He didn't say anything. He just held it hard for a long moment, and his face did what faces do when words are insufficient. Renee looked at her from the bed. Her voice was rough from the oxygen tube. "The paramedic said I coded." "You did," Laura said. "You came back." "Were you scared?" Renee asked. It was not the question Laura had been expecting. She looked at Renee Torres, a woman who had just had her heart stop, who had just come back from a place that most people only go one direction, and she thought about the question with the seriousness it deserved. "No," she said finally. "I wasn't scared. I was focused." She paused. "The fear comes after." Renee nodded slowly, like that made exactly the kind of sense she'd needed it to make. Laura squeezed her husband's hand once and then released it and stepped back toward the curtain. "Thank you," Renee said behind her. Laura paused with her hand on the curtain. She didn't turn around. "Just get better," she said. She pushed back through and walked down the hall and didn't let herself feel anything about it until she was in the supply room with the door closed, and then she stood with her back against the shelves for exactly 45 seconds, with her eyes shut and her hands pressed flat against the cool metal, and she breathed. In, out, steady. She took the silver pen out of her pocket, turned it over once, then she put it back, straightened her scrubs, and walked back out. Whitmore was standing in the hallway. He was not pretending to be doing something else. He was simply standing there waiting with the directness of a man who had made a decision and was not going to be indirect about it. "Keating," he said, "Dr. Whitmore. Walk with me." It was not a question. She fell into step beside him. They walked the length of the corridor, past the bay doors, past the nurses' station, to the quieter end where the administrative offices were, and the noise of the trauma floor dropped to something manageable. Whitmore stopped. He turned to face her. "Marsh," he said, "the STEMI." "Torres, the arrest." "Yes." "Cho, the epidural." Laura said nothing. "The woman in Bay 2 with the bronchospasm." "The man in the waiting room with the arterial compromise." He listed them the way he might list items in an inventory, factually, with no drama in his voice. But his eyes were doing something different. They were doing what they'd been doing all evening, trying to reconcile the name on the badge with the evidence in front of him. "That's 5 critical interventions in 90 minutes, Keating. Each one correct. Combined, each one ahead of where the primary team was." "I noticed things," Laura said carefully. "I communicated them to the appropriate person." "You didn't just communicate them." Whitmore's voice was level. "In Torres, you initiated resuscitation before the alarm triggered. That's not nursing. That's not even standard resident level." He stopped himself. "What is your background?" Laura looked at him. And there it was, the question that had been building since the first ambulance. Maybe since the first day. Maybe since the moment she'd walked through the front doors with her methodical routine and her quiet eyes and her carefully tied hair. The question she had moved across the country to avoid being asked in exactly this way. "My background," she said, "is nursing." "Laura." It was the first time he'd used her first name. The shift in register landed in the silence between them like a stone in still water. "You've been watching me," she said, "all evening. Then you know what I can do." "I know what I saw," Whitmore said. "I don't know why someone who can do what you did tonight is filling out intake forms." Laura was quiet. The ventilation system hummed. Somewhere down the hall, someone laughed, brief, exhausted, the laugh of a person at the end of a very long shift. "Because intake forms need to be filled out," she said finally. "That's not an answer. It's the one I have right now." Whitmore studied her face for a long moment. He was 60 years old, and he had spent his professional life reading people, reading them the way Laura read patients, looking for the thing under the surface that the obvious signs were obscuring. What he saw in Laura Keating was not deception. It was not incompetence or hesitation or the vague inadequacy that Donna had described in her early assessment. What he saw was someone carrying something heavy, Someone who had made a deliberate choice to set down a particular version of themselves and was living carefully inside a smaller space than they were built for, and doing it for reasons that were entirely their own. "All right," he said finally. "All right, all right." He straightened. His voice returned to its professional register. "You're still assigned to Station 4, paperwork and basic intake." He turned to go, then stopped. "But if you see something, you communicate it directly, immediately to whoever needs to hear it. No more hanging back because you're worried about overstepping." Laura looked at him. "And if they don't listen, then come to me." He walked away. Laura stood in the corridor for a moment alone, and the ventilation hummed and the quiet end of the hospital breathed around her, and she reached into her pocket. Not for the pen this time, but for the bracelet, the thin silver thing with its coordinates engraved on the inside, and she held it in her palm without looking at it. She knew the numbers by heart. She knew what they meant. She put it back, and she walked back toward the noise, toward the bays, toward the next patient and the next clipboard, and the particular life she had chosen carefully on purpose, for reasons she wasn't ready to explain to anyone. Not yet. The last ambulance of the night left at 11:47 p.m. By then, Station 4 looked like a paper storm had passed through it. Intake forms stacked in order, every chart updated, every medication log initialed, every timestamp precise to the minute. Laura had done all of it. She had also, in the space of 3 hours, redirected 5 critical cases, run 1 resuscitation, and quietly prevented 4 complications that the official incident log would never attribute to her by name. The floor was beginning to decompress, the kind of slow exhale that happens after mass casualty events, when the adrenaline starts to metabolize and everyone realizes at the same time that their feet hurt and they haven't eaten since noon. Nurses were peeling off gloves, dropping into chairs, speaking in lower voices. The monitors still beeped. The lights were still bright. But the register of the room had dropped from emergency frequency to something that resembled human. Webb found Laura at the medication cart. He had been avoiding her since the Torres resuscitation, which was itself a kind of statement. A man who usually filled every available silence with the sound of his own confidence had spent 3 hours not making eye contact with the nurse he had told to her face that she was not authorized to act. He stopped beside her. He didn't say anything for a moment. Laura continued checking the cart inventory. "The Torres resuscitation," he said finally. "You called the epi before I processed what was happening." He paused. "You called everything before I processed what was happening." Laura wrote a number on her inventory sheet. The rhythm was there to call. "I've been doing this for 3 years." "I know." Another pause. "Where did you train?" It was the second time tonight someone had asked that question. Laura capped her pen, closed the inventory binder, and looked at Webb with the same patient-level expression she brought to everything. "Does it matter?" she said. He looked at her. Not with the brisk, dismissive confidence he usually wore, but with something raw underneath it, the expression of someone who has had a foundational assumption quietly removed and is recalibrating in real time. "I told you to step back," he said. "During Torres, I pulled rank on you and told you to step back." "Yes." "If you had—" "I didn't," Laura said. Webb exhaled through his nose. It wasn't quite an apology, and it wasn't quite not one. He was 28 years old, and he had been trained in the specific vocabulary of medical hierarchy, and he did not have a ready script for this particular conversation. "I'm trying to say, ma'am, you were doing your job," Laura said. Her voice wasn't unkind. "You assessed what you could see, and you made a call based on your training. That's what you were supposed to do. And you saw what I didn't. I saw something different. That's not the same thing as seeing better." Webb stared at her. "That's a very generous framing." "It's an accurate one." She picked up the binder. "Go eat something. You've been on for 14 hours. He watched her walk away with the expression of a man who had just been handed something he didn't entirely know what to do with. It was Jessica who found her 20 minutes later in the supply room, doing what Laura always did at the end of a shift, checking that everything was where it should be, that nothing was short, that the next team would walk into a room that was immediately as it needed to be. Jessica leaned against the doorframe. She was 24, newer to the floor than Laura, and she had spent the last 3 hours watching everything with reabsorbing eyes. Can I ask you something? Jessica said. You're going to regardless? Laura said, not unkindly. During the Torres code, when you started compressions. Jessica hesitated. You didn't look scared. You didn't even look, I don't know how to say this. You didn't look like someone who was figuring it out as they went. You looked like someone who had done it 100 times. Laura kept checking the shelves. What's your question? Have you done it 100 times? The supply room was quiet. The ventilation hummed. From down the hall, someone was rolling a cart over the linoleum, and the wheels squeaked at irregular intervals. More than 100, Laura said finally. Jessica was very still. Where Laura turned, she looked at Jessica, really looked at her the way she looked at patience, measuring the depth of the question behind the question. Jessica wasn't asking to gossip. She wasn't asking to report back to anyone. She was asking because she was 24 years old and she was trying to figure out what kind of nurse she wanted to become. And she had just watched something tonight that had rearranged the furniture in her understanding of what was possible. Different places, Laura said. A long way from here. Were you, Jessica stopped, started again. Were you military? The word landed in the room and stayed there. Laura looked at her for a long moment. Then she said very simply, I was a combat medic for 8 years. The sentence was so plain, so quietly delivered, that it took Jessica a full 3 seconds to absorb it. 8 years, Jessica repeated. 2 deployments, multiple theater operations. The last one was 14 months. Laura turned back to the shelf. After that, I came home and retrained as a civilian nurse. She paused. I wanted something quieter. Jessica stood in the doorway with her mouth slightly open and the look of someone trying to fit a new piece into a puzzle they'd thought was nearly complete. All those things you've been catching, she said slowly, the subtle stuff, the things everyone else missed, that's not, she stopped, that's not luck. No, Laura said, it's pattern recognition. You see enough trauma, you start to read the signs before they get loud. She closed the last cabinet. The body always warns you. Most people don't know how to listen. Can you teach me? Jessica said. It came out fast like she'd been holding it. Not just tonight. I mean, can you actually teach me what you know? Laura looked at her and something shifted in her expression. Not warm exactly, but open. The way a door opens that has been closed for a very long time, not with drama, but with the simple mechanical fact of a handle being turned. Ask me questions when you have them, Laura said. I'll answer them. It wasn't a yes, but it was something, Jessica nodded. And then, because she was 24 and had just had the longest night of her short career and emotions were running close to the surface, her eyes went bright and she said, I'm really glad you were here tonight. Laura looked at her for a moment. Then she picked up her binder and walked to the door and paused beside Jessica and said very quietly, so am I. She walked out. And that was the moment the shift truly ended. What followed was not dramatic. Real life rarely is after the crisis passes. Laura drove home in her used Honda showered heated up soup she didn't really taste and sat at her kitchen table with her notebook open and wrote down every patient she had seen that night, every observation, every intervention, every outcome she knew about, and everyone she didn't yet. She wrote for 40 minutes. Then she closed the notebook, set the silver pen on top of it, and went to bed. She lay on her back in the dark and stared at the ceiling and did not sleep for a long time. Because the part she hadn't told Jessica, the part she hadn't told anyone, was that being right every single time came with a cost that the people who admired the results never had to pay. Every correct call was shadowed by the calls you'd gotten wrong. Every life you saved, I lived in the same memory as everyone you hadn't. And in the dark, in the quiet, there was no adrenaline to metabolize, no clipboard to focus on, no next patient to move toward. In the dark, there was just the accounting. She reached under her pillow and held the bracelet in her closed fist, not looking at it, just holding it, and eventually, somewhere around 3 a.m, she slept. 2 days later, Whitmore called her into his office. It was the first time she'd been in there. It was a working office, medical journals stacked on the credenzas of certificates on the walls that he clearly didn't look at anymore. A desk with the specific organized chaos of a man who thought faster than he filed. He gestured to the chair across from his desk without preamble. Laura sat. He remained standing. He had a folder in his hand that he set on the desk but didn't open. The night of the bus crash, he said. I had the outcomes reviewed. All right? Torres Cho Marsh, the bronchospasm in Bay 2, the arterial compromise in the waiting room. He tapped the folder. 5 interventions, 5 correct reads, all ahead of the primary care team, all communicated and acted on in time. He paused. In trauma medicine, we track something called predictive accuracy, the ability to identify a deteriorating patient before their vitals collapse. In the best trauma surgeons I've trained, I see predictive accuracy around 60 to 70%. Laura said nothing. Yours that night was 100%. The silence in the office had a particular quality to it, the quality of a room where someone is about to say something that changes the shape of a conversation permanently. Whitmore, I'm not finished. He sat down now, leaned forward. I've been running ERs for 22 years. I have never seen anyone without an MD, without even an NP, credential work at that level. Not once. His voice was direct, not unkind, but with the weight of a man who has decided to stop being careful. You told me your background was nursing. I looked at your application file. Laura's chin came up slightly, just a fraction. St. Patrick's College of Nursing, Dublin. Top of your cohort. He paused. That's your civilian credential. But before that, nothing. 3 years of employment history before your nursing degree is listed as overseas work general services. He looked at her. That's a military redaction, Laura. I've seen them before. The room was very still. Laura sat in the chair across from him, and her face did not change the calm, measured expression she wore like a second skin, but something in her eyes shifted. Something that looked for just a moment like the expression of someone who has been carrying a weight for a long time and has just felt the first person to reach out to take some of it. You've been in that file for 2 days, she said, since the morning after the crash. And I want to understand who I have working in my IER. He said it plainly, not to expose you, not to change your assignment. He stopped. Tried again. Laura, if there's something in your history that explains what I saw that night, then I need to know it. Not for HR, for you, because whatever you're carrying it alone. And in my experience, that works right up until it doesn't. It was, she would think later, the most honest thing anyone had said to her in 2 years. She looked at him. She picked up the bracelet from her pocket she'd taken to keeping it in her hand lately, rather than deep in the fabric, and she set it on the desk between them. Whitmore looked at it, then at her. Mosul, she said. He recognized the coordinates. 14 months, she said. 8th Forward Surgical Team. I was senior combat medic, which in practice means you are the surgeon, the anesthesiologist, the triage officer, and the chaplain, often at the same time in conditions that don't appear in any training manual. She said it without drama, like she was reading from her notebook. You make calls that attendings with 20 years of experience would hesitate over. You make them in seconds. You make them right, or someone dies, and the someone is often 22 years old and has a photograph of their family in their chest pocket. Whitmore didn't move. I was good at it, Laura said. That's the thing nobody tells you about being good at something terrible. The better you are, the more of it you get. The more of it you get, the more it counts. She picked the bracelet up and turned it over once. I came home and I was 29 years old and I knew how to manage a sucking chest wound in a collapsed building, and I could not. Her voice didn't break. It just stopped for a single beat, very controlled. I could not sit at a dinner table with my family without reading their body language for signs of distress. I could not watch the news. I could not sleep without running triage on every sound I heard. She put the bracelet back in her pocket. So I retrained, she said. Civilian nursing. I wanted to help people. I just wanted to do it without, she paused, without being who I was over there. Whitmore was quiet for a long time. The kind of quiet that is not absence but presence, the quiet of someone listening so completely that words stop being necessary. The night of the crash, he said finally, when I assigned you to paperwork. Standard call, I was new. You didn't know. Did it? He stopped. Was that hard, being told to stand back when you could see what needed doing? Laura looked at him steadily. It's always hard, she said. You see someone deteriorating and every piece of your training is screaming at you, and you have to decide how much to push and how much to respect the structure you're operating in. She paused. But I also know what happens when people who think they know best stop respecting the structure. I've seen that end badly too. So you walked the line. I tried to. Whitmore sat back in his chair. He looked at her with an expression she didn't have an easy name for respect, certainly, and something older than that, something that looked like the kind of regard that takes years and hard experience to grow. I'm going to ask you something, he said, and I want you to hear it as a question, not a demand. All right. Jessica Tran, the young nurse, second-year Bay assignments rotating. She came to me this morning and asked if she could do the supplemental training with you. He paused. She didn't say why. She just said she'd learned more from you in one conversation than she had in 6 months of orientation. Laura was quiet. There are 4 other nurses on this floor, Whitmore continued, who have been quietly asking better questions since you started, catching things earlier, flagging things they would have walked past before. He let that sit for a moment. I don't think that's coincidence. I answer questions when I'm asked, Laura said carefully. I know. He leaned forward. What if I asked you to do it more formally? Not a title change, not a public announcement. Just make yourself available. Share what you know. Let people learn from you. He looked at her. You said you wanted something quieter. But Laura, you can't turn off what you are. I watched you try it for 6 weeks, and what actually happened is you saved 5 lives while pretending you weren't. Laura looked at the desk between them. She was quiet for a long time. Long enough that the ventilation cycled twice and a cart wheeled past in the hallway, and somewhere down the floor a monitor beeped 4 times and went quiet. I'm not ready to be senior combat medic Keating again, she said. I'm not asking you to be. Then what are you asking? I'm asking you to be Laura Keating, he said simply. Whoever that is now, whatever that looks like in this ER, I'm not asking you to be what you were. I'm asking you to stop hiding from what you are. She looked at him, those calm, seeing eyes, the ones that had been watching everything since the first day, cataloging and assessing and storing the eyes of someone who had learned that the most dangerous things were always the quietest. I can't promise you I'll never pull back, she said. There are days when it's too much. When I walk in and the smell of the antiseptic and the sound of the monitors and the particular way a patient is lying in a bed, it puts me back somewhere I don't want to be. And on those days, I need to work the periphery. Intake forms, supply checks, the quiet work. That's a fair condition, he said, and I'm not taking a formal title. Also fair. And nobody announces this, no staff meeting, no memo. If nurses ask me questions, I answer them. That's it. Agreed. She held his gaze for a moment. Then she gave a single short nod. It wasn't a ceremony. It wasn't a speech. It was 2 people in a working office reaching an understanding that didn't require more words than it had already used. Whitmore stood. He extended his hand across the desk. Laura stood and shook it. His grip was firm. Hers was firmer. One more thing, she said before she turned to go. She looked at him. The marsh STEMI, the arterial compromise in the waiting room. Those were caught by the nursing staff before either of us got there. Brian ran the EKG on Marsh the moment I flagged it. The triage nurse moved on the hand case immediately. She paused. The people in this ER are good. They just need someone to show them what to look for. Whitmore looked at her, and for the first time since she'd walked through the front doors of St. Alders Hospital, the expression on his face was something unmistakable. It was pride. Yes, he said, they do. Laura walked out of his office and down the hallway and back to the floor. She passed the nurse's station where Donna was reviewing charts and Brian was restocking the medication cart, and Jessica was writing notes from the previous shift with the focused intensity of someone who has decided to become better and means it. Nobody looked up. She went to her locker. She took out her stethoscope. She hung it around her neck. She went back to work. The weeks that followed were quiet in the way that only looks quiet from the outside. Inside the emergency department of St. Alders Hospital, something was changing slowly without announcement. The way rivers change the shape of riverbeds. Not visibly, not dramatically, but in ways that become undeniable when you step back and look at the whole picture. It started with Jessica. True to her word, Laura answered questions when asked. She didn't seek Jessica out. She didn't schedule sessions or create lesson plans or frame any of it as teaching. She simply made herself available in the margins of the shift during the slow hours between 2 and 4 a.m., when the floor quieted during supply checks, during the 12-minute overlap between shift changes, when there was a pocket of time that belonged to no particular crisis. Jessica used every single one of those pockets. "You told me the body always warns you," she said one night, walking beside Laura during a routine floor check. "So how do you hear it when everything else is loud?" Laura didn't stop walking. "You tune the loud stuff out." "That's easy to say." "No, it isn't," Laura said. "It took me years, but the principle is simple. The loud thing is already being handled. Your job is the quiet thing that isn't." She paused at bed 11, looked at the patient, an elderly man sleeping post-procedure, and then kept walking. Your eye gets trained to slide past the obvious and look for the off note, the thing that doesn't fit, like hearing one instrument in an orchestra playing slightly wrong. Jessica thought about that. "And tonight, right now, what's the off note?" Laura glanced at her sideways. It was the closest she came to a smile. "Base 7, the woman with the hip fracture. She's been repositioning herself every 4 minutes. Her pain medication should have her comfortable enough to stay still." Jessica turned to look at base 7. The woman was awake, shifting slightly, her jaw tight. "Her pain isn't managed," Jessica said slowly. "Her pain isn't the problem. She's repositioning because lying flat is making it harder to breathe. Small bilateral pleural effusion, probably. Post-op accumulation." Laura's voice was completely matter-of-fact. "Tell the night resident. Get a chest x-ray ordered. She doesn't need emergency intervention, just adjustment and monitoring." Jessica was already turning toward the nurse's station. "Jessica," Laura said. She stopped. "Notice that you saw it," Laura said. "Because you did. You were already watching her. I just told you what to look for." Jessica looked at her for a moment, then nodded and kept going. The chest x-ray confirmed bilateral pleural effusion. Small, manageable, exactly as Laura had described. The resident adjusted the patient's positioning and ordered monitoring. The woman slept through the rest of the night without distress. In the morning, the resident who'd ordered the x-ray mentioned it during handover as his own observation. Laura heard about it secondhand from Brian. She wrote it in her notebook and said nothing about it to anyone. That was the other thing nobody understood about Laura Keating. She genuinely did not care who got the credit. This confused people more than almost anything else about her because in the particular ecosystem of hospital medicine, credit was currency, and the accumulation of it was how careers were built and reputations were established and hierarchies were enforced. The idea that someone might contribute something real and then simply walk away from the credit, not out of strategy, not out of false modesty, but out of actual indifference, didn't fit in any category most of the staff had available. Webb, who had spent 3 years in the specific competitive metabolism of residency, found it genuinely baffling. "The pleural effusion," he said to her one morning at the medication cart, "that was yours." "It was Jessica's," Laura said, not looking up. "She was the one watching the patient." "Because you told her what to look for." Telling someone what to look for isn't the same as looking for them. She initialed a form. She saw it. She acted on it. That's hers. Webb stared at her. "You could be building a case," he said. "Every one of these interventions, every correct call, if you documented them properly, attached your name to them, you'd have grounds to apply for an advanced practice credential. You could be working at a completely different level." "I'm working at exactly the level I want to work at," Laura said. "That doesn't make sense." She looked at him. "Why not?" "Because you're better than this, better than intake forms and supply checks and Webb." Her voice was quiet, but it stopped him. "Do you know how many people are alive right now because a nurse caught something the doctor missed? Not because the nurse was better than the doctor, just because she was standing in a different place with a different angle at the right moment." She held his gaze. "That nurse never needs a credential for it to matter. The patient doesn't care about the credential. The patient just needs to go home." Webb was quiet for a moment. "Then you really mean that?" "I really mean that." He picked up his chart. He walked away with the look of someone reconsidering a framework they'd built their entire professional identity on top of. It was on a Thursday, 5 weeks after the bus crash, that the first real test of what Laura had quietly built arrived through the doors. Her name was Margaret Osei, 63 years old, retired school teacher, brought in by her daughter because she was, as the intake note read, confused and tired. Her vitals were unremarkable. Her EKG was normal. Her blood sugar was slightly elevated, but within a manageable range. The attending on call, Dr. Reeves, the same one who had dismissed Laura's concern about the internal bruising on her first week, reviewed the chart, noted dehydration and possible early-stage urinary tract infection, causing confusion, and ordered fluids and a UA. Standard call. Textbook presentation. Jessica was assigned to Mrs. Osei's bay. She started the IV fluids. She checked the vitals. She did everything correctly and in order. And then she stood at the foot of the bed and looked at Margaret Osei the way Laura had taught her to look. Not at the chart, not at the monitors, but at the person, and something made her stop. Margaret was sitting up. She was answering questions in short, slow sentences. Her eyes tracked normally. Her hands were folded in her lap. Nothing about this picture should have been alarming. Except her left hand. It was in her lap, same as the right, but it wasn't folded. It was just resting, slightly open, slightly lower than the right, as if someone had placed it there and it hadn't found its own position. Jessica thought about Laura's voice in her head, the off note, the thing that doesn't fit. She walked to Mrs. Osei's right side. "Mrs. Osei, can you squeeze my hand?" Margaret squeezed, firm, normal. Jessica walked to her left side. And this one, Margaret looked at her left hand with a faint, puzzled expression. She tried to squeeze. The grip was half what it should have been. Jessica's pulse went up. She kept her face calm. "Mrs. Osei, I'm going to ask you to do a few things for me." "Okay, can you smile as big as you can?" Margaret smiled. The right side of her face moved. The left pulled slightly less. "Can you repeat this phrase for me? The early bird catches the worm." Margaret repeated it. One word was slightly slurred. Just one. Easy to attribute to tiredness. Easy to file under elderly patient, mildly confused. Easy to miss if you weren't listening for it. Jessica walked out of the bay. She found Laura at the nurse's station. "Mrs. Osei in Bay 9, Jessica said. Her voice was steady. She was proud of that. Left-sided weakness, mild facial asymmetry, one word of slurred speech, onset unknown. Laura looked at her, and she didn't say good. She didn't say well done. She just said, "Code stroke. Get Reeves now." Jessica was already moving. What happened in the next 8 minutes was the particular controlled explosion of a stroke protocol activating the team, converging the rapid neurological assessment, the imaging order, the clock starting. Reeves, to his credit, took one look at the exam findings and moved without hesitation. Whatever his blind spots, he was not a man who let ego slow him down when the evidence was in front of him. The CT confirmed ischemic stroke, left MCA territory. Small, early, exactly the window where intervention changes everything. Margaret Osei received TPA, the clot-busting medication, within 53 minutes of arrival. The neurologist who reviewed the case said that another 90 minutes without treatment, and she would have had permanent deficits. Another 3 hours, and they were talking about a very different outcome. She left the hospital 11 days later and walked out under her own power with her daughter holding her arm and both of them crying, and she stopped at the nurse's station on her way out. She asked for the nurse who had first noticed something was wrong. Donna brought Jessica over. Margaret Osei took Jessica's hand in both of hers and said, "My daughter told me what you caught, what it means." Her voice was still slightly slower than it had been before, a small remnant of what the stroke had taken. "I'm a teacher. I taught 3rd grade for 31 years. I have 43 former students who became teachers themselves." She squeezed Jessica's hand. "Because of you, they still have someone to call on their birthdays." Jessica stood there with tears running down her face and managed to say, "I had a good teacher." Margaret looked at her. "Then you tell her." That afternoon, Jessica found Laura in the supply room. Always the supply room, always checking, always making sure the next person would walk in to find what they needed, and she told her exactly what Margaret Osei had said. Laura listened. She was quiet for a moment. Then she said, How did it feel? Catching it yourself. Like, Jessica, stop. Try it again. Like the difference between hearing about something and actually seeing it with your own eyes. Good, Laura said. Hold on to that. That feeling is what makes you better. She went back to her inventory. Jessica watched her for a moment. Laura, you're not doing this just to answer questions, are you? You're doing it on purpose, building something. Laura set down her pen. She turned and looked at Jessica with an expression that was more open than usual, less carefully composed, more human. One nurse, she said, can only be in one place at one time. Jessica waited. But if that nurse teaches 5 others to see what she sees? Laura picked up her pen again. Then she's in 5 places at once, exacto. The silence in the supply room had a different quality after that. The kind of silence that means something has been understood. Then Donna's voice came over the intercom, crisp and carrying. Trauma bay. All available. Now. They both moved. The patient who came through the doors that evening was a man named Thomas Greer. 44 years old, brought in by private vehicle. His wife had driven him because she said he'd been complaining of chest pain for 6 hours, and she'd finally had enough of him saying it was indigestion. 6 hours. That number landed in the trauma bay and sat there. Reeves took the case. He moved efficiently. The 12-lead EKG was ordered immediately. The vitals obtained. The standard chest pain protocol initiated with the kind of smooth professionalism that made St. Alders a good hospital. The EKG came back. Reeves looked at it. Non-specific changes, could be early ischemia, could be positional. Let's get troponins and watch him. He set the EKG on the cart and moved to write the order. Laura was across the bay. She was not assigned to this case. She had no reason to be looking at that EKG from 12 feet away, but she was looking at it. And something in the pattern, something in the specific geometry of the waveform, the particular way 2 of the leads showed changes that in isolation meant nothing, but together meant something she had seen before in a field hospital outside Mosul, when a 31-year-old soldier had the same complaint in the same underwhelming EKG. And it had coded on the table 40 minutes later, made her go absolutely still. She walked across the bay. Reeves, she kept her voice completely level. He looked up with the expression of a man who had learned over the past several weeks to pay attention when Laura Keating used that voice, and who was not entirely happy about what that response said about his earlier assumptions. Lead AVR, she said. She pointed at the EKG without touching it, and the reciprocal changes in the lateral leads. Together. Reeves looked at the EKG again. His expression shifted. Left main, he said, quietly. Like a word you don't want to say too loud. Or proximal LAD, Laura said. Either way. Left main coronary artery occlusion. The widowmaker. The kind of cardiac event that looks on a busy Tuesday evening like indigestion right up until the moment it doesn't look like anything at all because the patient has arrested on the table. Reeves was already reaching for the phone to call cardiology. Thomas Greer was in the cardiac catheterization lab within 22 minutes. The interventional cardiologist found a 94% occlusion of the left main coronary artery. She placed a stent. She told Thomas Greer's wife afterward in the family waiting room that her husband had been approximately 1 hour away from a massive cardiac event that, given the location and severity of the occlusion, he would very likely not have survived. His wife sat with that information for a long moment. Then she said, "Who caught it?" The cardiologist, who had only been told that a nurse had flagged the EKG, said, "One of the ER staff." Thomas Greer's wife nodded. She wiped her eyes. She said, "I want to thank them." Reeves found Laura at the end of the shift. He was a different man than the one who had dismissed her on her first week. Not dramatically different, not transformed, not converted, not wearing humility like a new coat he'd just purchased. He was just a good doctor who had been wrong about something specific and who had enough integrity to acknowledge it in the specific rather than the general. "The Greer EKG," he said. "I would have watched and waited." "It's a reasonable call with that presentation," Laura said. The changes are subtle." "But you saw it." "I've seen that pattern before, in a different context," where he said it not as a challenge, but with genuine curiosity. The curiosity of a physician who has encountered the edge of his own knowledge and wants to understand what lies past it. Laura looked at him. She thought about Mosul. She thought about the 31-year-old soldier in the field hospital, and the particular smell of desert dust and generator exhaust, and the way the EKG machine had flickered because the power supply was inconsistent and she'd had to read the strip by flashlight. A place where the equipment wasn't always reliable, she said. So you learned to read the patient instead of the machine. Reeves nodded slowly. Is that something you can teach? Some of it, she said. The pattern recognition takes time. But the instinct to look past the machine, yes, that's learnable. Then teach it. He held her gaze. Not just to Jessica, to the residents too, if they're willing to listen. Laura was quiet. Are they after Greer? He gave a short, dry laugh. They will be. She thought about what Whitmore had said in his office. Stop hiding from what you are. She thought about what she'd said to Jessica in the supply room. One nurse can only be in one place at one time. She thought about the silver bracelet and the coordinates and the 14 months that had taught her everything she knew about the cost of excellence and the weight of being the person who could not afford to be wrong. Start small, she said finally. One session, informal. I'll talk about EKG pattern recognition and atypical presentations. No titles, no official structure. When? Next Thursday, midnight to 2, the quiet window. Reeves nodded. He turned to go. Reeves. She stopped him. He turned back. The UTI confusion presentation 2 weeks ago, she said. Mrs. Park, you caught a drug interaction that nobody else had flagged. I noticed that. He looked at her surprised. You're a good doctor, she said. I just have a different set of eyes. He stood with that for a moment. Then he nodded again, and this time it was different, not acknowledgement, but something closer to the kind of respect that can only exist between equals. He walked away. Laura stood alone in the corridor for a moment. She put her hand in her pocket and felt the pen smooth and familiar under her fingers and the bracelet looped around it. She thought about the Thursday session. 6 residents, maybe 8 nurses, a conference room, a stack of de-identified EKG strips, and a dry erase board. She thought about being senior combat medic Keating in a room that smelled like dust and diesel, running a trauma call, by flashlight teaching a 20-year-old field medic how to read a wound by touch, because there was no imaging and no time, and the choice was learn or lose him. She thought about how the 20-year-old had learned, how fast the human mind absorbs something when the stakes make it impossible to look away. The stakes were different here. The room smelled like antiseptic, not diesel. The lights worked. The machines were reliable. The people asking questions had had 8 years of formal education and would have 12 more before they were fully trained. But the principle was the same. You see what you're taught to see. You catch what you're prepared to catch. And if someone who has already learned the hard way can hand that knowledge forward quietly without ceremony, without putting her name on it, then maybe that is the thing. Maybe that is the whole point of coming home and starting over and sitting in cafeterias eating sandwiches and pretending to be just a nurse. Not to hide what she was, but to use it differently. Her pager went off. Bay 3, incoming trauma. She put everything else away. She pulled on her gloves. She started moving. The incoming trauma was a 12-year-old boy named Eli Warren. He had fallen from a second-floor window, playing his father said, voice cracking on the word like it was made of something brittle. Just playing. Eli hit the concrete patio below, and his father had called 911 before he finished falling. He came in conscious, crying, right arm visibly fractured, road rash across his left-sided, vitals chaotic from pain and fear. Laura was already gloved when the gurney came through the doors. Anon took primary. She was good with pediatric cases, patient precise, able to modulate her voice down to the frequency that kept a frightened child from going fully non-cooperative. She began her assessment smoothly, talking Eli through each step, keeping him focused on her face while her hands moved over him with clinical efficiency. Laura stood at the periphery. She was not assigned to this bay. She had pulled on her gloves from reflex, from proximity, from the particular alertness that activated in her whenever a child came through those doors, a sensitivity that had nothing to do with protocol and everything to do with something older and less articulable. She watched Eli. He was crying, which was good. Crying meant air. Crying meant consciousness. His vitals were elevated, but consistent with pain response. His pupils were reactive. Anand was calling out findings in the calm, methodical cadence of someone who knew what she was doing and knew she knew it. Laura was about to step back, and then Eli stopped crying. Not because he calmed down, not because the pain eased. He simply stopped. His face went from the red, crumpled expression of a child in pain to something flat and distant, the way a television goes when the signal cuts out. Laura was moving before she finished the thought. Anand. Her voice was sharp, not loud sharp, the specific edge that cuts through noise without adding to it. Anand looked up. He's crashing, Laura said, right now. His vitals are, look at his face. Anand looked, and to her absolute credit, she did not hesitate. All hands Bay 3, now. What came next was the controlled violence of a pediatric resuscitation, the team converging in the monitors, screaming the particular horror of a small body requiring the same aggressive intervention as an adult, but with every margin compressed, every tolerance narrower, every second carrying more weight. Eli Warren had a tension pneumothorax. The fractured rib from the fall had punctured his lungs slowly at first, and then all at once, the way these things always go quiet and then catastrophic without adequate warning in between. Anand called the needle decompression. She had done it before, knew the procedure, her hands were steady. But the angle was wrong. Eli had twisted during the resuscitation attempt, and the standard landmark was compromised. And for one suspended second, Anand hesitated, recalibrating. And in emergency pediatric medicine, one suspended second is a unit of time that has real cost. Laura was beside her. Rotate him 15 degrees left, she said. Your landmark shifts to the third intercostal. I'll hold his shoulder. She didn't wait for permission. She repositioned Eli with the precise, practiced movement of someone who had done this in conditions that made a clean trauma bay look like a luxury and held him exactly still. Anand found the landmark. She placed the needle. The rush of air was immediate. Eli's chest expanded. His color changed. The monitor began pulling back from the edge. The room exhaled. Anand looked at Laura across Eli's body. Her eyes said everything her voice didn't have time for. Laura stepped back. She stripped off her outer gloves. She turned toward the door. She had a supply check that was 40 minutes overdue and a stack of intake forms from the previous 2 hours, and she was going to go do those things because that was her job, and the crisis was managed, and Laura. She stopped. It was Whitmore's voice. He was standing at the bay entrance. She didn't know how long he had been there. Long enough, clearly. He looked at her with an expression she recognized now, the one he wore when he had decided something and was not going to be indirect about it. My office, he said, when you're done with the supply check. She almost smiled. You knew I was going to do the supply check first. I've worked with you for 3 months, he said. Yes. She did the supply check. She did the intake forms. She updated the medication log and verified the overnight handover notes and made sure the blue binder at Station 4 was current to the minute. And then she walked down the hallway to Whitmore's office and knocked once and pushed the door open. He was not alone. There was a woman sitting in the chair across from his desk, mid-50s, straight back, the kind of posture that suggested either military service or 30 years of refusing to let the world slouch her. She was wearing civilian clothes, but they sat on her the way civilian clothes sit on someone who spent a long time in uniform. She had a file folder on her knee, and she was holding it with both hands, and she looked at Laura when she came in with the particular look of someone who has been waiting for a specific person and has just confirmed the identification. Laura stopped in the doorway, every cell in her body recalibrated simultaneously. Laura, Whitmore said carefully, this is Colonel Patricia Marsh, U.S. Army Medical Command. She reached out to the hospital 3 days ago. Laura looked at Colonel Marsh. Colonel Marsh looked back at her. Senior Medic Keating, she said. Her voice was measured and direct. It's been a while. It has, Laura said. She did not move from the doorway. Colonel? Come in, Whitmore said. Please. She came in. She did not sit down. I'm going to tell you why I'm here, Colonel Marsh said, because you deserve the direct version, and I'm not going to waste your time with a preamble. She opened the folder. 18 months ago, a field medic named Corporal David Ewan was in a vehicle during a route clearance operation outside Kabul. IED strike. 3 casualties. Corporal Ewan managed all 3, maintained 2 of them through a 40-minute medevac window, in conditions that the attending trauma surgeon at Bagram described as, and I am quoting directly, the most technically proficient field stabilization he had ever reviewed documentation of. Laura said nothing. Corporal Ewan, when asked where he had learned the specific techniques he used, cited his training under one senior combat medic, Keating. Specifically a session you conducted in Mosul in 2019 on managing multiple casualties with limited equipment, a session you ran during your off hours, unofficial, undocumented, because you wanted the younger medics to be better prepared than the standard curriculum made them. Colonel Marsh looked up from the folder. Those techniques kept 2 soldiers alive, who the survival statistics said would not have made it. The office was absolutely quiet. Laura stood very still. She was pressing the silver pen against her thigh through her scrub pocket, and she was not aware she was doing it. I'm not here to recruit you back, Colonel Marsh said. I want to be clear about that. Your discharge was honorable, your service record is exceptional, and whatever your reasons for transitioning to civilian life are entirely your own. She paused. I'm here because the Army Medical Command is developing a training curriculum for advanced field trauma management, specifically the kind of improvised, limited resource, high casualty techniques that the standard TCCC course doesn't adequately cover. We're looking for people who have not only practiced those techniques, but have demonstrated the ability to transmit them effectively to others. She closed the folder. Corporal Ewan told us where to find you, she said. It took us a year to act on it because, frankly, we didn't expect you to be in an ER filing intake forms. We thought you'd be running a trauma program somewhere. I file intake forms very well, Laura said. Colonel Marsh looked at her. Something in the older woman's expression shifted, not surprise, but recognition. The look of someone who has met this specific brand of quiet before and knows exactly what it costs. Yes, she said, I imagine you do. Whitmore, who had been sitting behind his desk with the careful stillness of a man who knows he is witnessing something he should not interrupt, cleared his throat gently. I'll leave you two. Stay, Laura said. Then softer, please. He stayed. She looked at Colonel Marsh. What exactly are you asking me to do? Consult. 2 days a month remote when possible on-site at Fort Sam Houston quarterly. Review curriculum drafts, provide case-based input from your field experience, and if you're willing, record training scenarios. Not classroom instruction, practical applications, the stuff that only comes from having actually done it. 2 days a month, Laura said. 2 days. Your civilian life stays exactly as it is. Laura was quiet for a long moment. She looked at the floor. She looked at the wall. She looked at the folder in Colonel Marsh's hands, and then at the window behind Whitmore's desk, and then at nothing in particular, the way people look when they are not seeing the room they're in, but the room inside their own head. The corporal, she said finally. Ewan, he's all right. Purple Heart, currently instructing at Fort Bragg. She absorbed that. And the 2 soldiers he kept alive. Both returned to active duty. One is getting married in June. Laura closed her eyes for exactly 3 seconds. When she opened them, they were clear and dry and steady. Send me the curriculum drafts, she said. I'll review the first module before I commit to anything formal. If the approach is right, we'll talk about the rest. Colonel Marsh nodded. She stood. She extended her hand and Laura shook it, the same firm, no-ceremony grip she used for everything. Senior Medic Keating, the colonel said. It's Laura, she said. Just Laura. Colonel Marsh accepted that with a nod that suggested she understood exactly what it meant. She picked up her folder and walked out. The door closed. Whitmore looked at Laura. Laura looked at the chair the colonel had been sitting in. You didn't know, she said, that she was coming for that reason, no. She told me she wanted to speak with a staff member about a consultation opportunity. I didn't know the details. He paused. Are you all right? Laura thought about the question with the honesty it deserved. I don't know yet. That's a fair answer. She sat down then in the chair, the one the colonel had occupied, and she put her elbows on her knees and her face in her hands for a moment, and she breathed. Not the controlled 45-second version she did in the supply room. Just breathing, just being a person in a chair in an office at the end of a long night with all of it sitting on her at once. Whitmore did not speak. He did not offer reassurance or analysis or any of the things that would have required her to be composed enough to receive them. He simply sat across the desk and was present in the room while she found her way back to the surface. After a while, she lifted her head. 8 years, she said. In one conversation, and it's all right there, like no time passed. Does that frighten you? No. She thought about it. That's what frightens me. That it doesn't frighten me. That part of me heard that folder open and felt ready. Felt like myself. Maybe that is yourself. Maybe. She sat back. Or maybe myself is also the person who catches the plural effusion by watching a woman reposition herself in a hospital bed. Maybe both things are true at the same time. Whitmore looked at her with the expression she had come to recognize as his version of warmth, not demonstrative, not soft, but present and unambiguous. I think they've been both true since the day you walked through my door. Laura was quiet. For what it's worth, he said, this hospital is better because you're in it. Whatever you decide about the Army curriculum, I want you to know that. Not as a persuasion, just as a fact. She looked at him. I know, she said. Thank you. She stood. She smoothed her scrubs. She took the silver pen out of her pocket and held it in her hand for a moment, the weight of it, the cool metal, the two engraved letters that she had carried as a reminder for 3 years now. DP, differential pressure, the hidden danger, the thing most people couldn't detect. She had thought of it all this time as a caution, as a warning to herself, remember that the most dangerous things are the quietest. Or remember to look beneath the surface, remember that what you can see is never the whole story. But standing in Whitmore's office, with the colonel's visit still reverberating through her and the sound of Eli Warren's chest expanding on the right side of her memory, and Jessica's face the day Margaret Osei walked out of the hospital, under her own power, she thought maybe the pen meant something else too. Differential pressure worked in both directions. It was not only the pressure of things collapsing inward, it was also the pressure of things being held up. The invisible force that kept a structure standing when everything around it was in chaos. She put the pen back in her pocket. She put the bracelet on her wrist. She had never worn it before. She had only ever carried it. But she put it on now, right-hand wrist coordinates facing inward against her pulse point, and she looked at it for a moment, the small silver band, and the numbers that meant Mosul, and meant 14 months, and meant every impossible decision she had ever made in a place with no good options, and she thought, I'm not hiding from you anymore. She walked out of Whitmore's office. It was 4:23 in the morning. The ER was in the quiet register that only exists in the hours before dawn, not silent, never silent, but breathing rather than screaming. Monitors beeped in their steady rhythms. The overhead lights hummed. Somewhere in the secondary area, a patient was talking on the phone in a low voice. Jessica was at the nurse's station updating charts. She looked up when Laura came down the hallway, and she noticed the bracelet immediately, the way you notice something on a person that was not there before, and she didn't say anything about it, but her eyes asked the question. Laura sat down next to her. The Thursday session, she said. Jessica straightened. The EKG session with the residents. Expand it, Laura said. I want to add a module on pediatric assessment, specifically respiratory compromise in post-traumatic presentations. She paused. And after that, field triage principles. How to prioritize when the resources don't match the need. Jessica stared at her. That's 3 sessions. That's a whole curriculum, Laura said. The words sat there between them, and it had weight and shape and the particular kind of permanence that comes when someone who has been holding something back finally puts it down on the table and says, here, this is the thing, this is what I have. Jessica looked at her for a long moment. What changed? Laura thought about Corporal Ewan in a vehicle outside Kabul using techniques from an unofficial midnight session in Mosul to keep 2 soldiers alive for 40 minutes until the medevac arrived. She thought about the 31-year-old she had not been able to save, whose face she still saw sometimes in the particular quality of light at 4 in the morning. She thought about the wedding in June, one soldier, a scar, a bride, a room full of people who would never know how close it had come. Someone told me that what I know is already out there, she said, in people I taught a long time ago, in situations I wasn't there for. It's already doing things I'll never know about. She looked at Jessica. If that's true, then every person I teach here is another extension, another place I can be when I can't be everywhere. Jessica's eyes were bright. She pressed her lips together for a moment, controlling whatever wanted to happen to her face. Then she nodded once firmly, like a person accepting a commission. Thursday, she said, I'll have the room booked by morning. Laura nodded. She pulled a chair up to the station and opened the nearest chart and began working through the overnight backlog with the quiet, methodical precision that had baffled and then impressed and then humbled everyone who had watched her long enough to understand what they were actually looking at. Brian passed by with a fresh pot of coffee. He set a mug down next to her without being asked. Without a word, the small, wordless acknowledgement of a man who has been changed by proximity to something he couldn't have predicted. Donna walked in from the administrative wing, reviewed the board, reviewed the bed status, and then stopped beside Laura and said, not warmly but directly, which for Donna was the same thing, "Eli Warren is stable." His father asked for the names of the staff who worked the bay. "I told him we don't give out names," she paused. "I did tell him that the nurse who called the redirect was one of the best we have." Laura looked up. Donna was already walking away. Reeves came on at 5 a.m. for the early shift. He found Laura at the station, passed her a cup of vending machine coffee that was significantly worse than Brian's and said, "Thursday session, can we add a segment on soft tissue trauma assessment? I've got 3 residents who keep missing the early indicators." "Yes," Laura said. "Good." He moved to his station. He stopped, turned back. "The Greer family sent a card to the department. It's on the board." He paused. Admin listed it as a general commendation for the care team. "That's appropriate," Laura said. His wife asked specifically about the nurse who flagged the EKG. "What did admin tell her?" "That it was a team effort." Reeves looked at her. "Which is what you would have wanted." "Yes," she said. "It is." He nodded. He went to work. Laura sat with her coffee and her charts in the particular steady rhythm of a hospital ER at 5 in the morning. The sky outside beginning its slow shift from black to the dark blue that comes before dawn, and she thought about nothing complicated. She thought about the next patient. She thought about Thursday's session. She thought about Corporal Ewan getting married. No, that was the other soldier, the one whose life he'd saved getting married in June. She thought about a 12-year-old boy breathing evenly in a recovery bay, with his father sitting beside him, holding his uninjured hand, grateful for a noise that had no name but sounded exactly like his son staying alive. She reached into her pocket for the silver pen. Her fingers found the bracelet on her wrist instead. She left the pen where it was. She opened the next chart and she began to read. And outside the hospital, the sky kept turning and the city kept breathing, and somewhere in the building a new shift was beginning. Nurses arriving, residents rotating the whole living machinery of a place that existed for the single purpose of making sure people got to go home. Laura Keating had us come to this hospital to disappear, to be small, to do quiet work in a quiet corner and ask nothing of herself beyond the modest, manageable dimensions of a regular shift. What she had done instead was something that couldn't be taken back and couldn't be undone and didn't need a certificate or a commendation or anyone's official acknowledgement to be exactly, permanently, irreversibly real. She had made them better. All of them, Webb with his recalibrated humility, Jessica with her new eyes, Brian with his steady hands, Reeves with his genuine questions, and every resident, Eric, who would sit in that conference room on Thursday night and leave understanding something they had not understood when they came in. She had made them better, and they would make others better, and those people would make others better still. And somewhere down that long, unbroken chain, a patient would survive who otherwise wouldn't have, and that patient would go home to people who needed them. And none of it would ever be traced back to a woman who arrived early and checked the supply cabinets and kept a silver pen in her pocket and moved like a ghost through the emergency room, seeing everything, saying only what needed to be said, and never once asking to be seen in return. That was the whole point. That had always been the whole point. Laura Keating turned to the page and kept reading, and the dawn came in through the hospital window steady and unhurried, and she was exactly where she was supposed to be.